Since my pandemic videos are proving so popular,
You're joking, right?
I thought it was time to do another one.
Oh man!
The first part of this video is a follow-up to an earlier one I did, where I looked at the bizarre difference between the Victorian hospitalisation numbers compared to other states.
Spoiler alert.
I do have some answers. The second part of the video, well, you'll just have to keep watching and find out. Okay then, let's start with some data nerd stuff. You didn't have to be an expert in anything to realise that this winter was going to get ugly. With almost all public health measures to curb transmission of the virus wound back, and the governments and media all selling the back to normal message, case numbers were bound to explode. Even a potato can tell you that more cases equal more hospitalisations and more deaths. Previously I've talked about how the Victorian hospitalisation numbers made no sense when stacked up against the other states of Australia. And finally, thanks to the help of Jenny Gump on Twitter, I know why. I've started to see a few people point to the relatively low, and it is relative, hospitalisation numbers in Victoria compared to New South Wales as a sign that Victoria is travelling okay in comparison. I mean, when you break it down to hospitalisations per 100,000 population, Victoria does look good. It's sitting at the very bottom of the list. Where it gets fishy is when you do the same state-by-state comparison looking at deaths. In this measure, Victoria is clearly the worst. So how can a state have the lowest hospitalisation figures on one hand and the highest death figures on the other? The answer? Well, it seems like creative accounting to me. So Victoria only counts COVID-19 hospital admissions if they are currently in hospital and testing positive. Typically a patient remains positive for 5 to 7 days. Other states, however, report hospital patients originally admitted with COVID-19 for a full 14 days. Now, to be fair, this issue also popped up in November last year in The Age, but I'd completely missed it. So besides making it impossible to directly compare Victoria's hospitalisation figures to other states, it's also giving the public the wrong impression of the scale of pressure the Victorian healthcare system is under. Based on the current caseload and using the definition that the other states do, the Victorian hospitalisation figure is far more likely to be approaching the 2,000 mark, rather than the 800 to 900 that's being currently reported. Why all states aren't required to report using consistent and agreed definitions is absolutely beyond me. Now let's look at the health advice. I'm not going to lie, this could be a little bit dry, so here's some puppies. One of the positives to come out of that whole pandemic legislation drama from last year is that now the Victorian government are required to release the health advice behind their decision making, and make clear where that advice has been adopted or where it's been rejected. In issuing pandemic orders, the government first receives written health advice from the Chief Health Officer, followed by a meeting, which is then followed by the issuing of the orders themselves. In issuing the orders, the Minister for Health must also issue the creatively named Statement of Reasons. In other words, a document outlining the reasons why health advice was accepted or rejected. The most recent round of health advice issued by the Acting Chief Health Officer to the Minister for Health on the 7th of July made for some pretty grim reading, and quite a bit of it didn't get reported on. The health advice itself was clear and unambiguous. Here are some highlights. With global transmission remaining high, we should expect new variants, and we should not be surprised if vaccines and treatments are less effective against them. Long COVID is in fact a thing, and it is in fact a thing the government should be concerned about. It's also something likely to have a long-term impact on our people and our health systems. There is emerging evidence that shows the more often people get COVID, the higher their risk of a bad health outcome. In simple terms, COVID is a virus you should avoid catching. It's also a virus you should avoid catching multiple times. I guess the key takeaway here is that reducing transmission and getting people vaccinated is critical in reducing the short and long-term health impacts on the community and the healthcare system. The Acting Chief Health Officer went on to say that in order to reduce transmission, masks should be required in a wider number of settings, and the working from home should be encouraged where possible. Now, in the Minister for Health's Statement of Reasons, she says that the priority for the COVID response remains, among other things, to limit transmission. That's really good. I mean, the Chief Health Officer has advised that COVID is bad, getting it more than once is worse, and that long COVID is a real thing that the government should be concerned with. From there on though, pretty much nothing else in the document would indicate that limiting transmission is much of a priority at all. Yes, there are some strong recommendations.
Strongly recommended.
But there's really nothing more.
Under the Act, I'm required to seek advice from the Chief Health Officer. I'm also obligated to consult more broadly with business and community leaders and indeed with my colleagues. The Chief Health Officer has provided his advice and I have accepted his advice, except that I have chosen not to extend mandates for mask wearing in some of the settings that were recommended to me by the Chief Health Officer.
These are really the personal responsibility pandemic orders. It's the equivalent of thoughts and prayers.
Yeah. Standard thoughts and prayers.
He's got a thoughts and prayers template.
There are some odd statements though. In defending her decision to reject the advice on masks, she writes about the January wave, that I'd argue we're technically still riding, and how back in January businesses experienced staff shortages and had to close due to COVID.
Righto, with the number of workers in isolation and businesses forced shut, you'd be forgiven for thinking we're in the midst of another lockdown.
Businesses across the country feeling the crunch.
It's a really difficult time. It's a lot more difficult than when we were going through the lockdowns. I've spoken to a lot of small businesses, especially around the Chapel Precinct area, and they're all suffering with the same issues. Their staff are getting infected one after the other. Owners that haven't worked in their businesses, that have had their businesses under management, have had to go into their businesses and work behind the counter and just to help out where they can.
Well, it's not a shortage of stock, but of staff that is crippling retailers as COVID cases explode, sending more workers into isolation across the country. And while rules are easing for those in critical food areas, there's a call for them to be given free priority access to rapid tests and for the hospitality sector to get a look into.
It's like we're back at the start of the pandemic. Everything picked but sweet potato by 9 this morning. Only this time it's staffing, not stock. That's the issue.
In my mind, that should be a case for trying to reduce transmission and accepting the health advice, not rejecting it. And on working from home, she requests that employers consider working from home arrangements that are most appropriate for their workplace and employees based on individual requirements.
Yes, so once again, the decision about working from home is one that I believe is best made by employers and their employees.
Maybe it's just me, but that's hardly a strong directive. Understandably leaving many employers and employees wondering what to make of it. I've heard people say, literally say, that if the current situation was really that bad, the government would be telling us we had to do certain things. Not just suggesting or recommending.
Really?
Yep, really. That's where personal responsibility and strong recommendations are getting us. At this point, the only real difference between New South Wales and Victoria is that when New South Wales ignores the health advice, we need to wait a few months until it's leaked to the media.
Premier Dominic Perrottet said Dr Kerry Chant and New South Wales Health endorsed these changes. Is that true?
It is not strictly accurate, Peter. I've confirmed with multiple sources who are aware of the discussions last night with Dr Kerry Chant that she did not fully endorse this new roadmap. The Chief Health Officer warned the new Premier all of these changes come with risk, but changing a roadmap that was only 9 days old was ultimately a matter for the government.
No, not at all. I would just like to say that I had the opportunity to brief the Premier. I think the briefing went for well over an hour, almost two. Presented to Crisis Cabinet in the usual way. And as I, respect government's decisions around multiple inputs.
In Victoria, we only have to wait a week or so until the orders are published. I guess there's nothing much more to say other than thoughts and prayers.